Hello and good morning and welcome to our special broadcast tracking COVID-19, and over the next half an hour we'll get you all the news from India and abroad as far as tackling COVID-19 is concerned. But first, a look at the top stories. Train services to be further partially restored from the 1st of June. The Indian Railways will start operations of 200 passenger services. Bookings for all these trains commence from 10 in the morning today. These special services shall be in addition to the existing Shramik special trains and the special AC trains. Civil Aviation Minister Hardeep Singh Puri says the domestic civil aviation operations to recommence in a calibrated manner from the 25th. Says all the airports and the air carriers are being informed to be operation ready. The standard operating procedure for passenger movement also being separately issued by the ministry. Indian nationals continue to be brought back under second phase of the Vande Bharat mission. 1,500 Indians returned from Saudi Arabia, UAE, Oman, Kuwait and Qatar on the 9 special flights yesterday. Flights from Oman returns to Kerala's Calicut late night. Union Cabinet approves several schemes as mentioned in the Atmanirbhar Bharat package. The Cabinet approval for the allocation of food grains from central pool to approximately 8 crore migrants or the stranded migrants. Prime Minister Modi says important decisions taken which are focused on the welfare of migrants, poor, senior citizens will benefit several citizens across the country. Active cases of COVID-19 stand at 63,624 in India. 3,435 deaths reported, while 45,299 patients cured and discharged. The global COVID-19 cases nears 50 lakh, while over 3,28,000 deaths reported from the world over. US is the worst hit, followed by Brazil and Russia in terms of the number cases. And first up, the railways have decided to further restore the passenger train services from the 1st of June for transporting people across India. The railways will start operations of 200 passenger services. The booking of all these trains commences today from 10 o'clock on the IRCTC website and through mobile app. Now, these will be fully reserved trains having both AC and the non-AC classes. General coaches shall also have reserved seat for sitting. There will be no unreserved coach in the train. All the quotas shall be permitted in these special trains as has been permitted in the regular trains. However, only 4 categories of the Divyangjan concession and 11 categories of patient concessions are permitted in these special trains. All the passengers must compulsorily be screened and only asymptomatic passengers are allowed to enter or board the train. Also, all the passengers must wear face covers and face masks at the entry and during travel. No linen, blankets and curtains shall be provided inside the train. All the passengers must also all download and use the Arogya Setu app. These special services shall be in addition to the existing Shramik special trains being run. The railway spokesperson gave us more information on this.
30 दिन का एडवांस रिजर्वेशन पीरियड है। मतलब आप अगर आज टिकट बुक करेंगे तो आपको अगले 30 दिन की किसी भी दिन का किसी इन ट्रेनों में से किसी भी ट्रेन का टिकट मिल सकता है। ये ज़्यादातर ट्रेनें जो हमारी रेगुलर ट्रेन हैं उन्हीं के पैटर्न पे चलाया गया है। इनको थोड़ा सा नंबर में चेंज है, बाकी उसी पैटर्न पे, उन्हीं स्टॉपेजेस में, उन्हीं कंपोजिशन में और उसी टाइमिंग पे हमने इन ट्रेन को चलाया है।
Moving on now, in a big move, the Civil Aviation Minister Hardeep Singh Puri has announced that the domestic civil aviation operations will recommence in a calibrated manner from the 25th. All the airports and the air carriers are being informed to be ready for operations from 25th. The standard operating procedures for passenger movement are also being separately issued by the ministry. Meanwhile, the Home Affairs Ministry has deleted the domestic air travel of passengers from the list of prohibited activities in the lockdown guidelines.
Well, I'm very happy that we finally have announced the decision that flights will commence from Monday the 25th of May in a calibrated manner, and that these flights will go to all parts of the country. Initially, only a small percentage of the total number of flights, but depends on the kind of experience we gain. We will increase the number of flights, and this is a decision which was taken, and I want to express my satisfaction at the cooperation that we've been getting from all the stakeholders, from the airlines, from the airports. It's not been a secret. I have said actually that airlines and airports have been ready for the last 1 week. We were just waiting for the green signal, and I think I had also hinted that sequentially it would be necessary for us to first commence rail operation and only then bring in the domestic civil aviation.
So as the flight operations are all set to begin, Delhi's Indira Gandhi Airport has made elaborate arrangements for the passengers' safety, and each bag will be disinfected into a UV rays tunnel, and thorough screening through thermal scanners will be made so that the infection chain does not spread. And in fact, the infection there will be caught at the early stages, so all the precautions and measures there in place at the airports before the start of those domestic flights from the 25th. Moving on now, under the Vande Bharat mission, almost 9 flights from the Gulf repatriated more than 1,000 distressed Indians back to the country in a major evacuation process. The 9 flights that took off from Saudi Arabia, the UAE, Oman, Kuwait and Qatar to India brought back nearly 1,500 distressed and stranded Indians on these special flights. And talking specifically, 2 flights took off from Doha, one for Hyderabad and the other to Visakhapatnam, carrying 177 and 140 passengers. 2 other flights scheduled from Saudi Arabia were destined to Kannur and Dammam and then Bengaluru. This flight later reached Hyderabad as well. As the Dammam flight had 164 passengers, the Kannur flight had 152 on board. Also from Dubai, 2 other flights to Kochi and Bhubaneswar were scheduled. The flights ferried 177 and 148 passengers. In the meantime, the Kuwait-Thiruvananthapuram flight left with 175 passengers, and the Muscat-Bengaluru flights had 177 passengers. Another flight from Muscat to Kannur was also fully booked with 180 passengers and 2 infants. Now, with the extensive rescue operation being carried out in the Gulf nations, priority was given to the distressed blue-collared workers, medical emergency cases, expecting women, stranded tourists and elderly people on these special flights. About 6.39% of the total number of active COVID-19 cases in the country needed hospital support. Addressing media on the COVID-19 situation, the Health Ministry spokesperson said that during the lockdown, the hospital infrastructure has been upgraded, including the oxygen-supported beds, the ICU beds and ventilators. He said that the efforts of the government give confidence that we are ready and equipped along with the states to manage COVID-19 cases. The Health Ministry analyzed the data from the recently released WHO situation report and found that while cases per lakh of world population stands at 62, in India it was found that 7.9 people per lakh population were affected. He also said so far India has about 0.2 COVID-19 deaths per lakh population as against the global figure of 4.1. The Health Ministry spokesperson also said that evidence shows that pre-symptomatic, mild-moderate cases with no fever for 10 days will not spread infection. More than 42,000 patients have recovered, taking the recovery rate to 40% now. The doubling rate in the country is also 13.6 days. He said that the main focus is on upgrading the health sector in the country. In other news now, the Union Cabinet chaired by Prime Minister Modi has given approval to several schemes as mentioned in the announcements made by the Finance Minister as part of the economic tranches. The Cabinet has given its ex post facto approval for allocation of food grains from the central pool to approximately 8 crore migrants or the stranded migrants at 5 kilograms per person per month for 2 months free of cost. It would entail an estimated food subsidy of about 2,982 crore rupees. The allocation will ease the hardships faced by migrant or the stranded migrants due to economic disruption caused by COVID-19. The cabinet has also approved the additional funding of up to 3 lakh crore rupees to eligible MSMEs and the interested mudra borrowers by way of emergency credit line guarantee scheme. Under the scheme, 100% guarantee coverage to be provided by the National Credit Guarantee Trust Company Limited for additional funding of up to 3 lakh crore rupees to eligible MSMEs and the interested mudra borrowers in the form of a guaranteed emergency credit line facility. The Union Cabinet also gave its approval for the implementation of the Pradhan Mantri Matsya Sampada Yojana, a scheme to bring about blue revolution through sustainable and responsible development of the fisheries sector. The scheme will be implemented during a period of 5 years. Approval also given to extension of Pradhan Mantri via Vandana Yojana for the welfare of and to enable old age income security for senior citizens. The cabinet has also given its nod to a new centrally sponsored scheme, the scheme for formalization of micro food processing enterprises for the unorganized sector on the all India basis with an outlay of 10,000 crore rupees. And let's now take a stock of developments in India at ground zero. In Delhi's Okhla vegetable and fruit market, the police personnel were deployed and all the people entering the market were thoroughly checked. Thermal screening was also being conducted as per the prescribed guidelines. Moreover, people were seen following the rules of social distancing. And the Andhra Pradesh Transport Department has resumed its intra-state services. As the services resumed, people were seen boarding and deboarding the buses at the Pandit Nehru bus station of Vijayawada. In the Krishna district of Andhra Pradesh, almost 106 buses will run at its 38 roads, but keeping in mind the social distancing. In Assam's Dibrugarh, with the workers now returning to work after the restrictions got eased, tea plucking work has resumed in full swing. The move comes as government allowed full workforce in tea plantations amid lockdown due to COVID-19. With many tea gardens in Assam starting working with full workforce, the industry is back on track as lockdown norms are relaxed. However, proper measures to curb the coronavirus are being followed, with sanitization and social distancing being practiced thoroughly. The tea industry has welcomed the decision taken by the state government allowing full workforce in the tea plantations. In Chennai, a coronavirus-shaped robot was deployed in a containment zone to sanitize the area. The innovative robot can store over 30 liters of disinfectant. The robot is equipped with 4 wheels for easy movement across the streets. Broadway Street in Chennai was disinfected while several other districts were also sanitized. The Myoto Electric Mobility has come out with innovative idea to sanitize the hotspot and containment zones that has replaced the work of the health workers. In Kerala's Alappuzha, the banking services have got restored for poor as they remain cut off from the mainland due to the nationwide lockdown. For people living in islands in Alappuzha cut off from the mainland, banking services are reaching them, including facilities to withdraw money during the COVID-19 lockdown. The facilities provided by the banks are providing beneficial for the people living in these villages, particularly to those who need to withdraw pension and to gain the money allotted through various welfare schemes by the government. And let's now scan through the developments from across the globe in World Wrap. The World Health Organization has expressed concern for the rising number of new coronavirus cases in poor countries, even as many rich nations emerge from the lockdown. And in the meantime, the head of the WHO's emergency program, Dr. Mike Ryan, urged people to avoid using the malaria medicine hydrochloroquine except for conditions it is proven to treat.
Every sovereign nation, particularly those with effective regulatory authorities, is in a position to advise its own citizens regarding the use of any drug. However, from the the hydroxychloroquine and chloroquine are already licensed products with indications for many diseases. I would point out, however, that at this stage, hydroxychloroquine, norchloroquine have been as yet found to be effective in the treatment of COVID-19 or in the prophylaxis against coming down with the disease. In fact, the opposite in that warnings have been issued by many authorities regarding the potential side effects of the drug.
Also, the WHO chief, while reacting on the letter received by the US, said that they have received the letter and they are looking into it.
On the letter, we have, of course, received the letter and we're looking into it.
The overall number of global coronavirus cases has gone up to 49.6 lakh, while the death toll has risen to over 3.2 lakhs. The US has so far registered more than 15,49,000 cases of infection, with the death toll surpassing 93,400. The US has recorded 1,561 new coronavirus deaths in the past 24 hours. The US health officials have also released more reopening guidance, as all the 50 US states have partially reopened after a 2-month shutdown. Meanwhile, California unveiled plans to reopen its world-famous entertainment industry next week. In New York, the city mayor has offered free coronavirus tests at the city's 169 nursing homes. He also said that the nursing homes will provide staff to replace nursing home employees who test positive for the virus. Russia recorded its lowest total of new COVID-19 cases since the 1st of May on Wednesday, with more patients discharged from the hospital than the new cases for the first time, which showed that the outbreak was stabilizing at last. Russia now has the second most cases of COVID-19 in the world, behind only the US. Wednesday's tally of 8,764 new cases brought the official count above 3 lakh, while the death toll reached 2,972. And as the Russian Prime Minister, who returned to work this week after himself recovering from the COVID-19 virus, said the news that more patients had left hospital than tested positive showed that the situation is gradually stabilizing, especially in Moscow. Now, in its 8th week of a lockdown, the capital Moscow has been by far Russia's worst hit region. Meanwhile, a Russian biotechnology company said that they will soon complete the clinical trials of the drug for patients suffering from severe form of COVID-19. The levolumab drug that was originally developed to treat rheumatoid arthritis have shown good results as a potential cure for patients with confirmed COVID-19 infection. That's according to company's website. And in Moscow, about 18,000 people are seriously ill in hospitals. That's according to city's mayor. The capital, that has been the epicenter of the outbreak in Russia, is the second largest in the world. Meanwhile, the Russian Prime Minister Mikhail Mishustin, who returned to work this week after himself recovering from COVID-19 virus, considers of lifting the lockdown. Our correspondent Lucy Taylor reports from Moscow.
Moscow has been in partial lockdown since the end of March. People here are only allowed to go outside for a limited number of essential activities. Moscow's mayor, Sergei Sobyanin, now says he'll open some government offices and allow some planned medical treatment to go ahead. But he said it's too early to talk about lifting the ban on outdoor exercise or walks. The situation is still far from ideal, with about 18,000 people seriously ill in hospital. Prime Minister Mikhail Mishustin says it's time to lift quarantine restrictions in some areas of the country. Lucy Taylor in Moscow.
Situation far from ideal, and so we all need to exercise precautions at all costs. And talking about Brazil, where the coronavirus outbreak has worsened on Wednesday, and the South American nation could soon have the second highest number of cases in the world, as the health ministry reported 888 new deaths and nearly 20,000 new infections in a single day. Meanwhile, Brazil's lower house of Congress approved a proposed law that would make the use of personal protection masks in the public spaces mandatory. Infection has also affected 44 ethnic groups in the country, while President Jair Bolsonaro unveiled new rules expanding the prescription of chloroquine. And fresh graves were being dug in a massive cemetery in Brazil's largest city a day after the country overtook the UK to become the country with the third highest number of infections. Last week, the health minister Nelson Teek resigned, becoming the second top health official to leave the post since the pandemic began. Brazil might soon trail only the US in the number of COVID-19 cases. Russia currently has the second highest number of cases, and Brazil's coronavirus death toll is 18,859. And an update now from Spain, whereas Spain has recorded 27,888 deaths and 2.32 lakh cases of COVID-19, with the new fatality showing to under 100 a day. Spaniards remain divided on the extension of the state of emergency for the fifth time, and the country hopes to mostly lift a strict lockdown by the end of June. However, Prime Minister Pedro Sanchez wants to give special powers for 2 more weeks to control the easing of restrictions. But as the public protest simmered over the COVID-19 crisis, damage to the economy and tough social restrictions, some are against the state of emergency being extended any longer. And Spaniards have agreed with the government's decision to make it compulsory for all the citizens, including children over 6, to wear masks in public as one of Europe's strictest lockdowns gradually unwinds. The Health Ministry order said that masks would be needed for indoor public spaces and outdoors when impossible to keep a 2-meter distance. Meanwhile, in Madrid and Barcelona, requests are coming in to progress to phase 1 as both the metropolitan cities remain in phase 0 of the government's de-escalation plan. The British Prime Minister Boris Johnson has said that a program to test and trace those suspected of having been in contact with the people who tested positive for COVID-19 would be in place by 1st of June. And speaking in Parliament, Johnson said that the government would have recruited 25,000 trackers by the start of next month, capable of tracing 10,000 new cases a day, when the overall number of daily tests would have reached 2 lakh. However, the COVID-19 tally of Britain reaches at 2.49 lakh infections, while the death toll has gone up to 35,786. That's an increase of 363 on the day before. Now, food chain McDonald's has ramped up its UK operation by reopening drive-through lanes at its 32 restaurants and having closed all its outlets when the country imposed nationwide lockdown measures to stem the spread of COVID-19. McDonald's hopes to have all its drive-through open by early June. The 32 pilot restaurants are all located in southern England. And Britain's queue in cars as some McDonald's drive-thrus have reopened. Moving on now, the European Union tourism ministers on Wednesday met via video conference to discuss how to kickstart Europe's embattled tourism industry. The meeting comes after Germany's foreign minister Heiko Maas met his European Union counterparts, warning that while some travel might be possible, it won't be business as usual. Our Europe correspondent has some more details on that. Take a look.
Well, Germany's Foreign Minister Heiko Maas met with his EU counterparts on Monday to discuss what summer holidays might look like for EU travellers and those from further afield. Essentially, whilst some borders will reopen, it will not be business as usual. Things like face masks on planes or strict social distancing in restaurants, as well as on beaches. In hotels, some lounges by the pool will be drilled to the ground to ensure that people maintain a safe distance from each other. Meanwhile, there's been the announcement of a major EU recovery fund announced by the leaders of France and Germany, Emmanuel Macron and Angela Merkel. This is some €500 billion that will be put towards funding countries who've been badly hit by the virus, like Italy and Spain, as well as the hardest hit sectors. Significantly, this would be issued as grants, not loans, which is something long called for by those countries in the south of the bloc. But it's already being met with opposition by countries in the north of the bloc with more robust economies like Austria, Denmark and Finland. They say they are opposed to the idea of the money being issued as grants and that the money should instead be issued from an EU-based loan from which countries like Italy and Spain can borrow. We do see another row over EU solidarity between north and south on the horizon. Lucy Hoff, Dordashen News, Brussels.
And before we end this edition of Tracking COVID-19, let's listen to this beautiful song written and composed by two extremely talented brothers, Samyak and Sauramya, signifying the importance of Arogya Setu app and the Atmanirbhar Bharat.
ये नज़ारा है एम्स जोधपुर का, जहां बीएसएफ के 42 कोरोना पॉजिटिव जवान अपनी मजबूत इच्छा शक्ति और बेहतर इलाज के बाद ठीक होकर अपने अपने घर लौट रहे हैं।
आप लोग देख सकते हैं कि करीब
खुशियों के पल हैं सीएपीएफ रेफरल हॉस्पिटल ग्रेटर नोएडा के, जहां आईटीबीपी।
We'll keep getting you more updates on COVID-19 and much more news from across the nation and the world. But for now, it's a wrap. Thanks for being with us.